Hey guys, it's me again. I told you that I would update after chemo, and it is now almost 7 p.m. I was in chemo for approximately 4.5 hours today, which is really 3.5, 4 hours is about standard for me. The nausea has really kicked in, and so this episode we're going to be talking about side effects and how side effects are different for every single person. Your side effects may not necessarily be the same side effects that I have. Mine may be weird mutant things that, you know, have never happened to anyone else ever. But I did tell the doctor today about all of them. And so I'm going to talk about the basics. Nausea is number one. Pretty much everybody gets nausea. They give you nausea medication, and then they even gave me extra nausea medication, like the strongest nausea medication that they could, that insurance would allow. And I have 2 prescriptions for pills that I take for nausea, and it still feels like I just want to sit down and let my mouth fill up with vomit and just let it all go out. Either that, or else maybe carve into my stomach and just let it all out. That way, that's probably going to taste a lot better. I've had staples in my stomach before. I could do that. Well, maybe not. Maybe not such a good idea. Anyway, the second thing is bone and joint pain. I'm not receiving any of that right now. I know it's to come very soon, usually after the steroids wear off, which takes about 48 hours. Then the pain really starts to kick in, and it is like somebody trying to bend all of your joints backwards. It's really, really painful. The only thing I know that will touch it for me is my pain medication, and those are hydrocodones, and I don't even like to take the hydrocodones. So I try really hard to fight through the pain as much as I can, because hydrocodones have really bad side effects themselves, and I really don't want to talk about that because that is getting really gross. Another one of my side effects that I have is my heart hurts, and I think it's just, you know, it's poison coursing through my veins, coursing through my heart. And my heart is trying to do the best it can in order to make it happen as efficiently as possible. Yeah, the heart pain is there already, and it just makes me feel like I'm short of breath. I guess it's the same symptoms as a heart attack, but I've never had a heart attack. So I don't know that it's causing heart palpitations or anything like that. I don't feel like it's beating out of beat. I feel like it's just kind of just strained, I guess. It feels like it's very, very strained. Another one of my side effects is I get prismatic vision, which I asked both of the nurses about it today, and neither one of them have heard about this. But essentially something is happening, and it only happens when I have chemo, with the rods and cones in the back of my eye, and what it does is it superimposes prismatic shapes. I don't mean like geometry shapes. I mean like weird, like this one that I had most recently was kind of like a C just in the line of my vision, and it, when I closed my eye, it was still there. So that's how I know that it's the rods and cones. It's nothing else. Other than that, it's not. I have a little bit of blurred vision, but it's only at night. And sometimes if I concentrate and stare at carpet, I can kind of sort of make the carpet like expand and recede. If not really, but like in my vision, I can make it do that, which is really weird. I call it my superpower. But I can actually focus in on specific signs and whatnot and expand them in my own vision, in my mind, and I can, I know it sounds crazy, but I can actually read the signs, and it's really weird. Yes, I'm telling the truth. Another side effect, which you all know about, is the mouth sores and the open mouth sores. And I found out today that anything vascular and membranous, lips, gums, anything that's going to have blood vessels very close to the surface, that bleeds. Pretty much constantly, I found out. And I'm not the only person to have this. This is another common. Neuropathy is the next one. And that is tingling in your fingers and toes or complete loss of feeling. I actually get a complete loss of feeling in my big toes and the two, like the pinky and ring toes of either foot, and in my hands I get complete feeling loss in these two fingers in both hands and the tips of my thumbs. So I had to be careful whenever I'm cooking dinner, trying to cook dinner. I did cook dinner tonight, and I did eat, so that was good. The steroids helped that. But as far as other side effects that go, I know that some people have restless leg syndrome with their Benadryl. I used to. I don't know why I don't anymore. I don't know if it's a combination of the Benadryl that I receive and this new chemo that I'm on, but it used to be pretty bad. And the localized itching is another common side effect where you've got, remember, I think it was like the first video that I had maybe with the chemo, but I remember telling y'all maybe that I had specific places, like the back of my thigh, I remember that. Anyway, found out that that is normal with Avastin. So the longer you're on Avastin, the worse the itchies get. And I learned that some people even break out in whole rashes or hives. So I'll be using like the Benadryl stick on myself, or maybe get some calamine lotion. And as I talk about it, my hand's starting to itch. I think I just need to stop talking about it. Mind over matter, right? But I think that's pretty much it. The weirdest thing is the prismatic vision. Just really weird, the prismatic vision is. Because you look at something and you know it's supposed to, like, okay, for example, banana. I look at this banana and I see that it's an entire banana, but on this corner right here, and whenever I move my eye, I can see a C on it, like a backwards C, and it's all like psychedelic prismatic colors. It's very metallic looking. It's definitely an iridescent metallic psychedelic kind of weird swirly thing going on. So I might want to be careful with that. If it gets any worse, I'll probably have to have people drive me around. Not that I don't have enough volunteers doing that, because I definitely do. But I think that's probably my main concern. That and the heart pain. I just don't know if that's gonna, I did mention it today and he says that it's par for course, but is this how people have heart attacks with chemo? Because I've heard stories of that too, where their heart just kind of is it has been through too much and gets too weak, so, you know, the heart has a heart attack and it's like, hey, you know what? Maybe you should stop taking chemo. I feel strong. I feel like my heart is stronger than most, especially going through this for the third time. Like my cousin said, we're made out of strong stuff. So we'll see. We'll see if I can make it through this one, because the heart pain it hurts. It feels like, I guess a hammer, every time it beats, like a hot hammer is inside there, and it's banging against the walls. So, and it constantly feels like I have something in my throat now. But I'm going to sign off because I'm feeling very, very nauseous, and I think I need to make a trip to the throne room. And yeah, definitely cold sweats are coming out. So I guess I'll see you guys later. Make memories, and don't forget to live. And I love y'all.